Do you know the difference between Medicare and Medicaid? A lot of people think that they're the same thing, but in actuality, they're two very different programs. If you qualify for both, the benefits you can receive can drastically improve your healthcare coverage. In this video, I'm going to break down what Medicare is, what Medicaid is, who qualifies for each, and what happens if you're eligible for both. Understanding this could save you a ton of money and confusion, and it may open up some doors to benefits that you didn't even know were possible. Hello, my name is Edwin John Rodriguez, your licensed health insurance representative. And on this channel, we discuss all things health insurance with a focus on Medicare and ACA plans. Since 2007, I've had the pleasure of helping thousands of clients understand, compare, and enroll on plans that fit their needs and goals. My help is completely free, and our conversations are always transparent and unbiased. I often tell my clients I'm the best free help you'll never pay for. Now let's get into it. Let's start with Medicare. Medicare is a federal insurance program. It was designed back in 1965 to help older Americans get the coverage that they needed as they aged. Primarily covers individuals who are 65 and older, although it also covers younger individuals who have certain disabilities or chronic conditions such as end-stage renal disease. Medicare is broken down into multiple parts. The first part of Medicare is Part A. Part A is your coverage for inpatient care, where you're 24 hours or more in an inpatient setting. That means it helps cover inpatient hospital stays, skilled nursing facilities, hospice care, and even sometimes home health care. Most people don't pay a premium for Part A if they or their spouse worked long enough and paid Medicare taxes during their working years. Part B is your medical insurance, and this is coverage for your outpatient care. This is what covers your doctor's visits, outpatient surgeries, preventive services, and medical supplies. Next, we have Part D. Part D is your prescription drug coverage. It's offered through private insurance companies approved by Medicare, and it helps with your cost of your medications at the pharmacy. And then finally, there's Medicare Part C. This is also known as the Medicare Advantage plans. Like Part D, these plans are also offered through private insurance companies, and they bundle your Medicare's Part A, Part B, and usually Part D all into one plan. Many of these plans include extra benefits like dental, vision, hearing, and gym membership. Now let's talk about Medicaid. Medicaid is different. It's a joint federal and state program designed to help people with limited income, assets, and resources. So unlike Medicare, which is the same across the entire country, Medicaid is run by each state, so rules and eligibility requirements can vary depending on where you live. Medicaid can help you pay for things that Medicare doesn't fully cover, like your Medicare premiums, sometimes your deductibles and copays. It also can cover long-term care services such as nursing home care, which usually Medicare does not cover. And depending on your state, Medicaid may offer some additional benefits like transportation, dental, and vision services as well. So here's the simplest way to remember the difference. Think of Medicare as health care and Medicaid as financial aid. Medicare is mainly based on age or disability, while Medicaid is based on your income and financial needs. Medicare is a federal program and it looks the same in every state, while Medicaid is both federal and state, which means what you may qualify for in one state may look very different in another state. But what if you qualify for both? If you qualify for both Medicare and Medicaid, you're considered dual eligible. Now, this combination can actually open up some opportunities to help improve your plan and benefits. For example, Medicaid helps cover costs that Medicare doesn't, which means you can end up with little to no out-of-pocket costs for services related to doctor's visits, hospitals, and sometimes prescription drugs. You may also have access to dual special needs plans, also known as D-SNP plans, generally through a Medicare Advantage plan. These plans are designed specifically for people who have both Medicare and Medicaid, and they often include very rich benefits like grocery cards, utility assistance programs, comprehensive dental benefits, vision, hearing aid coverage, and even transportation to and from medical appointments. On top of that, they can protect you from late enrollment penalties for your Part D prescription drug coverage if you started your Medicare coverage late. So not only are you reducing your cost when you have both Medicare and Medicaid, but you're also gaining access to benefits that go far beyond what Medicare alone usually provides. Now, why does all this matter? The reason why all this matters is because a lot of people don't realize that they may qualify for both. Some people know that they're eligible for Medicare, but didn't know that they also qualify for Medicaid based on their income. The others on Medicaid and don't realize that they also are entitled to Medicare when they turn 65, or if they have certain conditions. So if you or a loved one qualifies for both, it can be a great way to improve your plan benefits and costs. Now, it's important to know that not every benefit you hear about applies to everyone. Your exact eligibility depends on your income, your state, and of course, your health situation. But if you do qualify for both Medicare and Medicaid, you're in one of the strongest positions for healthcare coverage in this country. So now you know the difference between Medicare and Medicaid and why having both can be so powerful. If you found this information helpful, go ahead and give it a like. It helps other people find this kind of honest guidance. And make sure to subscribe to stay informed about Medicare changes as they come out. If you need guidance related to your insurance on a one-on-one setting, you can also schedule a free call with my team using the link in the description below. No pressure, just clarity. And that, ladies and gentlemen, is a breakdown of both Medicare and Medicaid and how the two can work together. If you got value from this video, consider watching this video here as well. Until then, take care, and we'll see you in the next one.